Hey guys, this is Chad Madden, and I wanted to share something with you really quick that changed things up for me, at least in my private practice life. And it seems that as I'm talking with private practice owners all over the country, the general trend is we all clamor for, we're all attracted to marketing. But yet a lot of us shy away from or don't want anything to do with sales. And I think that comes from a couple places. One is that original AMA 1903 guidelines and principles statement of that basically we shouldn't advertise ourselves, and therefore we don't want anything at all to do with sales. But anyhow, that still permeates our healthcare environment today. But anyhow, let's just start with a basic definition of what marketing is and also what sales is. And I think if you have a clear definition of each, it's much easier to be successful in both areas, because you need to have good marketing, and then at the very least you need to be a good order taker to get some sales and get some patients actually through your doors, and also where they're receiving a full plan of care and they're compliant with what you're prescribing for them to do. So having said that, when you think of marketing, think of positioning. And what good marketing is it positions you against every other option that person has. So if you were in lower back pain, what are your options? Well, you could do hot pack, cold pack. You could do some sort of rub or ointment or liniment. You could see a chiropractor. You could go to the doctor. You could get an MRI. You could get an X-ray. And at least in my area, there are people that think an MRI or X-ray is actually treatment. You could get laser therapy. You could get laser surgery. You could get an injection. You could take over-the-counter medication. You could get prescription medication, or you could see a physical therapist. And if you're just in the niche of physical therapy, you could see a McKenzie physical therapist. You could see a hands-on manual therapist that does grade 5 mobilizations. You could see another one that does exercise only, perhaps myofascial release. So even within physical therapy, there are quite a few different options. Well, whatever your niche is, whatever your service is, that is what you are positioning against everything else. So when you're talking about marketing, you want to talk about positioning. And then here's a little nugget for you. If you do really good marketing, the sales effort, which we all despise, is almost nothing at all. It is truly like an order taker, where you go through, and at least when people come through our doors, because we've put a lot of conscious effort into our marketing and we're trying to attract a very certain type of patient, when they come to our doors, they view us a little bit differently than if we pulled them out of a mall as they were walking from the Gap in the mall down to the arcade or the food court. We're not doing that. That's like a used car sales type of setup. So when people come in here, they already see us as having authority, celebrity, and expertise, and they know that we've seen 12,000 people in our area, many for lower back pain, and they've heard the success stories. So it's a little bit different environment, and really my job as a physical therapist now, or the other DPTs that we have in-house here, they're just simply going through, and anytime the person has a stop or a barrier, usually it's time, money, or resources, or misunderstanding in terms of what's going on with their body, we just simply help them overcome that. But in the end, we're helping them through the process. We know where they're going to end up with a positive result because of physical therapy. They're going to get their life back, and we're just holding their hand, walking them through that process. A lot different than they're trying to get out the door and we're chasing after them. That isn't good marketing at all. So marketing, when we talk about marketing, we talk about position. And I want to give you two examples today. The first one is a pretty simple one. So if I'm a patient with lower back pain and I come to your office, are you going to give me a home exercise program? 99% of the time that's going to be a yes. And you're likely going to hand me a sheet that looks like this. Perhaps it's customized and has a few exercises on that are specific or individual to me. Well, a few years ago we were trying to solve this problem, and we wanted to position ourselves as being different than other physical therapy offices. So here's what we came up with. So we have a room with 2 4-foot by 8-foot sheets of pegboard, and every person that comes through, they get one of these. And this is a little exercise card carabiner. It says Madden PT on it. And then we have, so day one coming through, you get one of these. It has my card on if I'm your physical therapist. And by the way, here's my email here. If you ever have trouble, you can shoot me an email and I'll be able to answer your questions, so you'll never be stuck. Right? And we have that for each individual physical therapist. And then what we do is we have full color double-sided cards with very lay language, basic instructions with fill in the blank seconds and repetitions. So every time we add or take away an exercise, the person brings their card ring in, the patient brings their card ring in, and we can modify their program the whole way through the process. And we've had 0 complaints of the therapist didn't give me exercise instruction for at home, which we used to hear even though we were giving them sheets, because they would lose the sheets. This, they snap on their purse or they throw it in their back pocket, and they always have it with them. Pretty neat part of the process. The next thing that we do is we used to hand out a brochure, like a trifold brochure just like this, to the doctors. And basically, you know, if you have one of these, and there's a pretty good chance that you do, I want you to read it. I want you to open up the inside, and every time that you have I or we in, just make a little check mark. And for most of us, and I know that I did this myself, we tend to focus on saying things like, we are the premier rehab provider in our area, or we have a high quality of care, or we do things better. And we're constantly shining the flashlight on ourselves, shining the spotlight on ourselves, saying how great we are. And that gets old really, really quick to other cllinicians, especially potential referral sources. So the one thing that we did was we just did a little survey of our doctors, and we said, hey, if I would come through as a back pain patient, what would you do for me? And they all broke out this 1978 AMA sheet of exercises with 9 exercises on. 3 were for disc herniations, 3 were for arthritis or stenosis, so the classic Williams flexion exercises, and 3 were for pelvic instability. And I said, okay, great, Dr. Smith, which ones would you tell me to do? And they said, well, I would just give you the whole sheet. And I said, well, I can start and at least give you something valuable. So rather than a brochure that says how great we are, what if we created a brochure that had the 3 basic exercises for disc herniation, and then the 3 basic exercises, a separate brochure, which is 3 basic exercises for arthritis, stenosis, disc degeneration, and then the 3 basic exercises for SI joint and pelvic pain. And then pretty soon we had about 13 different categories that comprise 90 to 95% of the diagnoses that we see. Well, the great thing is we have physicians that hand out 2,000 of these every single month. So they're not necessarily referring, but they're giving patients something that has our stuff on it. So it has our logo, has our little Madden PT thing at the bottom on the back, and they're handing that out to the patient for more information. And if the patient wants to swim upstream, and here's an aside, they tend to be a really, really good compliant patient because they're doing a little bit of work to make it to us. They're not coming in saying, my doctor sent me here. Well, that's great, and it weeds out the process for us. The physician, the referral source, does some of the work, and as I said, we have 200 of these kiosks all over central PA, and we refill about 2,000 of these brochures every month, and now we're learning how to capture that traffic even more. So in terms of a position, I don't know any other physical therapists doing this in our area, let alone anywhere in the country. But I mean, there are 2 ways that you can position yourself, you can separate yourself from other healthcare choices. Hope this helps you out. You remember what marketing is, and I will talk with you next week. Thank you.